Guys, welcome. Just wanted to introduce myself. So I'm one of the exercise physiologists down in Geelong. Been with Keezer now since February this year, but been out for a couple of years doing in private practice mainly. Very much like educating and giving people some tips and tricks on how to manage their health. So we'll see how we go today. As Katie said, if you've got any questions, just put them in the chat box and I'll do my best to answer them for you. So just for today, there we go. This is what we're going to kind of cover. It's a bit of a long list, but I wanted to start off with some key terminology around diabetes, what it is. So we're going to talk about type 2, type 1, and gestational diabetes. We'll go through what's actually happening within the body for each of them, who's at the higher risk, symptoms, diagnosis, looking at some comorbidities, exercise guidelines, both the benefits but also the precautions of exercise, lifestyle factors and recommendations, then finish off with how can Keezer help. So looking at just the quick key terminology, so blood sugar levels, it's just the concentration of sugar or glucose present in the blood of humans at any given point in time. So when you eat food, your sugar levels go up. When you don't eat food and you maybe exercise, the blood sugar levels go down. That's just in theory, depending on which diabetes you have. Insulin, it's a hormone produced by beta cells of the pancreatic islets. It's the main anabolic hormone of the body and it regulates the metabolism of your proteins, your fats, your carbohydrates. It's just by promoting the absorption of glucose from the blood into the liver, fat and skeletal muscle cells. So pretty much when you eat food, how do we get that into our muscles and our tissue so we can utilize that to do physical exertion? Beta cells are just cells within the pancreas that just make the insulin. And another key term is ketoacidosis. It's a serious diabetes complication where the body produces excess blood acids known as ketones. This condition occurs when there isn't enough insulin in the body, and we'll go into that in a little bit more detail. So just some key terminology about what we're going to speak about today. What is diabetes? Diabetes is a chronic condition marked by high levels of glucose, so sugar in the blood. It is caused either by the inability of the body to produce insulin, so a hormone which is made by the pancreas to control the blood glucose levels, or by the body not being able to use the insulin effectively within the body. That's from the Australian Institute of Health and Welfare. A cool, really quick little stat. So an estimate of 1.2 million Australians, so about 6% of adults, so 18 years or over, have or had diabetes in 2017, 2018. And then another cool statistic was the ABS from 2011 to 2012 showed that for every 4 adults diagnosed with diabetes, there was 1 undiagnosed. So when you think about, the ramifications that has to people's health when they're not maybe being treated for what they need to be, it's quite profound. A little bit of a graph at the bottom here. So as you get older, the more likelihood you're going to have diabetes in the future, and we'll go into that a little bit later on. And men are more prone to it than females, just going off that graph as well. So what types of diabetes are there? We're looking at type 2 diabetes, type 2 diabetes, type 1 and gestational. So type 2 is usually a later onset. You usually produce insulin, however, do not produce enough or cannot use it effectively. It's also known as the lifestyle diabetes. It's associated with physical inactivity, poor diet, being overweight, obese. If you can get onto it early and if you can put some really good lifestyle factors in place, you can manage it really, really well. Type 1, it's an autoimmune disease. So it has nothing to do with, it potentially has some lifestyle implications, but it's got more to do with your body's immune system onset in childhood or early adolescence. It's really an unknown cause, but is believed to be a result of an interaction between genetic and environmental factors. This is where your own immune system has destroyed the beta cells within your pancreas, so your body doesn't produce insulin, so that's where you need to inject insulin into your body. Gestational occurs to glucose intolerance during pregnancy, mainly or mostly in the second or third trimester. Usually resolves when the baby is born, however, it can reoccur in later pregnancies. Definitely has a significant increased risk of developing type 2 diabetes for both the mother and the baby, and we'll go into that in a little bit more detail later on. So what's happening with each diabetes? So we've got a couple of little graphs to make it real simple to kind of follow. So there's something called pre-diabetes, which I haven't mentioned. That's a state between what we call healthy, but someone that doesn't have any or doesn't have diabetes, and before you go into type 2. So with a healthy person, what we're looking at is the liver, or the pancreas, sorry, produces insulin, which is the green things, attaches to glucose, which is the blue, and then gets transported into the cells, the muscles, and that's how we regulate our sugar levels within the blood. During pre-diabetes, so the pancreas produces more insulin to try and normalize increased glucose levels. So this is where we're starting to get a little bit of glucose intolerance. Continuously creating this much insulin can result in insulin resistance. So what that means is as you create more insulin, your body becomes more resistant to it. So you need to keep producing more and more. So it's a bit of a vicious cycle. So the more glucose found in your body, obviously the pancreas wants to produce more insulin. So it does, to try and get that glucose into the cells. And then also the glucose isn't absorbed as efficiently into the cells. So that's where we start to transition to that type 2 diabetes moving forward. So for type 2, so we've got the same picture here for what we classify as the normal, but as we become a type 2 diabetic, the actual pancreas can start to produce less insulin, because as we said before, that insulin resistance can become a factor. So all of a sudden, we're also destroying those beta cells within the pancreas. We still have a large amount of glucose in the blood. However, again, we're unable to move that glucose into the cells. So there's still more sugar being left in the bloodstreams, and that's where we can see that elevation of blood sugar levels within the blood of someone that's a type 2 diabetic. Changing your lifestyle factors tries to reverse this process, and I'll go into that in more detail soon. For a type 1 diabetic, some things have changed. So your immune cells have actually destroyed your beta cells within the pancreas. So the pancreas doesn't produce any insulin, meaning the sugar is just traveling within the bloodstreams. So what we want to do obviously here is inject that insulin so that those blood or the glucose can be transported into the cells, and we're able to maintain a good or a nice level of sugar levels within the blood. So with our type 2 diabetes, we're still able to produce insulin within the pancreas. Type 1 diabetes, we are unable to produce any insulin from the pancreas, and that's one of the key differences between the two. Moving on, going to gestational diabetes, so a bit more of a complex diagram here. So when you're pregnant, the hormones produced by the uterus reduce the effectiveness of insulin within the body, which means the pancreas wants to increase that production of insulin to try and get that sugars into the muscle cells. However, glucose is unable to move from vessels into the tissues of the body as well, just like in type 2 diabetes. And the more glucose that's around or in the bloodstreams, the more of it goes to the baby, which ends up leading to a greater than normal size of the baby. So if you tend to have a larger pregnancy, it means you've had probably more glucose within your bloodstream throughout the pregnancy. Moving on. So who has a higher risk of getting diabetes? So with a type 2, your previous family history, over 45, so over 55, and that's increasing as age increases. So it's not you get to 45 and there's just a static increase. It progresses as you get older. Being overweight, having high blood pressure, being Aboriginal or Torres Strait Islander, and then women who have given birth to a child over 4.5 kilos, or had gestational diabetes before, or have had polycystic ovarian syndrome, which is a hormone disorder causing hormone imbalances within the body. The only real thing that they can that's at a higher risk for a type 1 is just a strong family connection. So there's still a lot of research that needs to be done to try and work out what's going on with a type 1 diabetic. And then gestational diabetes, being over 40, have a family history of type 2, had previously polycystic ovarian syndrome, or gained weight gained weight too rapidly in the first half of pregnancy. So that's a really good indicator if you're going to potentially have gestational diabetes later on in your pregnancy. Some of the symptoms include blurred vision, kind of an acetone breath, nausea, vomiting, abdominal pain, excessive urination, excessive sugar in your urination. Can have extreme weight loss with the type 1 diabetes. We've got excessive thirst, excessive hunger, hyperventilation. Another good one is any scars or scratches. You don't bleed, so you don't heal as quickly with those scratches. So later on, we'll talk about extremities and people with type 2 diabetes having issues with ulcers and and their feet. So there's some of the symptoms to think about. Now, just maybe having one doesn't necessarily mean you have diabetes. It'll be a raft of reasons and symptoms, but then at the same time, getting a proper diagnosis, which we'll go into now. So a couple of things to look at. So with a type 2 diabetic, the gold standard is a HbA1c. That just shows the average of your blood sugar levels over the past 10 to 12 weeks and can be done every 3 to 12 months. So if anyone's come into Keys and seen one of our exercise physiologists or done one of the Activate groups, we will always ask, when was your last HbA1c? Because it's a really good indicator of where your blood sugar levels have been over the past long duration. A simple prick is a good acute or seeing what that is at right that point in time. You could have had a bag of lollies, you could have had even fruit, could be all raft of reasons why it's elevated. They don't just use the HbA1c to diagnose, they'll also use other ones like the fasting glucose tolerance test, where you'll fast for 8 to 10 hours, so usually overnight before taking just a simple blood sugar test, or the oral glucose tolerance test, where you do the same fasting, but then you'll come in, you'll drink a sugary drink, and your blood sugar levels will be periodically tested over the 2 hours, just to have a look at how well your body responds to that increase in sugar. So usually they'll kind of do a raft of tests, not just the one to diagnose, plus obviously symptoms as well. Type 1 diabetes, urine will be tested to look for the presence of ketones within your system. And then there's further testing can be completed to see if you have a destructive immune system cells associated with type 1 diabetes called autoantibodies. And again, they'll be looking at the symptoms and looking at the whole picture. Gestational, your doctor should screen you early in your pregnancy and can utilize tests outlined in the type 2 diabetes above. And so that should be a mandatory thing. Looking at comorbidities, so this is really important because having diabetes usually means you have something else. It doesn't matter if it's a type 1, type 2 or gestational, just at a higher risk. But a recent study done in 2016 showed that nearly 98% of adults with type 2 diabetes have at least one comorbid chronic disease, and almost 90% have two. So when we're thinking about managing your diabetes, it's not just about managing one condition, it's managing a whole raft of things and trying to get a plan that suits you and for you and your lifestyle. Just because you do have multiple things doesn't necessarily mean they can't all be managed. So for example, type 2 diabetes, you usually tend to have high blood pressure, so the next thing I'll go into. So there's exercise recommendations for using both resistance training, but also cardiovascular training as well, which will help with that blood pressure. Looking at that next point below, so up to 75% of adults with diabetes also have hypertension. Other comorbidities of diabetes are hyperlipidemia, so high levels of fat in the blood, cardiovascular disease, kidney disease, non-fatty liver disease, non-alcoholic fatty liver disease, obstructive sleep apnea, and obesity. So there's quite a few comorbidities that can potentially occur with type 2 diabetes. So number one important thing is, if you're going to get it managed, making sure that we maintain that we stick to the comorbidities that you have. So if you've got type 2 diabetes and hypertension, trying to avoid getting maybe cardiovascular disease or kidney disease. Trying to first maintain those two, and then obviously trying to treat them and get a good management for those conditions. For type 1 diabetes, there's links to other autoimmune disorders, so thyroid disorders, celiac disease, which affects the intestine's ability to tolerate gluten, Addison disease, which is affecting your adrenal insufficiency. In regards to, say, blood pressure and cardiovascular disease, there's not as much of a link there unless you're not, living healthy, sleeping, eating. It's more linked to other autoimmune disorders, which is to be expected because it is an autoimmune disorder, not a lifestyle disorder like type 2 diabetes. Gestational diabetes, got a higher risk of type 2 diabetes in the future if not well managed, which then leads to other things like blood pressure, cardiovascular disease. Untreated/poorly treated diabetes can lead to skin complications, nerve and eye damage. So especially in type 2 diabetes, where you can actually get some really poor nerve conduction, or your nerve endings start to deteriorate. So the messaging system from those nerves to your brain is impacted. So for example, with walking, if you've got some issues with your feet, you may step on a thorn, but your nerves don't actually anticipate that, don't send those signals to the brain. So that's when you can actually have may need to get amputations in extreme cases as well. Moving on, looking at exercise guidelines. So I really want to kind of focus on this for a little bit. So the guidelines state at least 30 minutes of moderate intensity, so can hold a comfortable conversation of aerobic activity every day of the week. Now, even in stage 4 restrictions in Melbourne, stage 3, you can still go for 60 minutes outside for exercise. So you should still be able to still manage the cardiovascular as best you within reason. So say you usually go for a bike ride, while in Melbourne it'd be a bit tough because you can only go right around 5 kilometres. So you may have to go for a walk, high-powered walk, maybe even a run. Stationary bike at home is a good one as well. You can also do vigorous as well. So if you want to do vigorous, so 30 to 45 minutes of vigorous intensity, so unable to hold a conversation on at least 3 days of the week. So 120 minutes a week of vigorous. So you can do either or. You don't have to do both. Some people will obviously prefer to do moderate, some people will prefer to do vigorous. You may want to do a combination of the two. As you can see here, the combination of moderate to vigorous aerobic activity. Plus, this is the key, plus 2 to 3 resistance training sessions per week. So it's not you just do cardiovascular exercise, we want to make sure we're doing resistance training exercise as well. So here at Keyser, we always recommend coming in 2 to 3 times per week, which fits within that those exercise guidelines. Due to obviously the restrictions coming in force now, you may have to adjust where you do that. If you may want to come into the centre, do assisted training sessions, home exercises. If you've got weights available at home, that can happen as well. So a combination, making sure that you're getting that enough cardiovascular exercise, but also resistance training. And the important thing is obviously the resistance training is to manage your sugar levels. So we're talking get better at managing, improving those systems of transmitting those glucose into the muscle cells, but then also that cardiovascular as well, as to help with those comorbidities, but also at the same time using that glucose as well. Benefits and precautions. So insulin works better when you exercise, or once you've been exercising, which will improve your diabetes management. Maintain a healthy weight, lower your blood pressure, reduce the risk of heart disease, reduce stress, which I think is a huge one. Just plus all the other benefits. So healthier joints, stronger muscles. You just feel better about yourself. Precautions. So this is really important. So you've both got what we call hypo and hyperglycemia. So hypo is when the sugar levels get too low, and so it can lead to visual disturbances, seizures, loss of consciousness, or even death. So for type 1 diabetics, they should always have, as you can see below, easy access to fast absorbing sugar for that reason when you're exercising. So it could be jelly beans, it could be a drink, something that's just on hand just if required. Hyperglycemia is when your sugar levels are too high, so it can lead to breathlessness, vomiting, feeling sick, but also getting those ketones in the blood system. So we don't really want to be exercising when those ketones levels are high as well. And also having adequate footwear, especially for a type 2 diabetic. We don't want to be getting, ulcers and, blisters and stuff like that, where, it can take, sometimes I've known people months to recover from having an issue with their foot, with it being having type 2 diabetes. Some lifestyle factors and recommendations to think about. So exercising regularly, so sticking to those exercise guidelines, that will change over the course of months to years. So I don't mean as in the guidelines will change, I mean what you do will change. So some months or some weeks you'll prefer to go for a walk, some you may join a bike group, your friends got you into an exercise class, or you're trialing ATs here instead of independent training. So that will, or at the Activate group, exercise group classes, that will, you want to make sure that we're still meeting those guidelines, but how you go about meeting them is going to change, and should change depending on what your body needs. The season, so at the moment it's winter, so it's very cold. In summer you may do more outdoors stuff. Eat healthy. So I always just focus on a well-balanced diet with normal portion sizes. It can be that simple. There's a link here to Diabetes Australia that has some information on eating well. I'm big on just eating a lot of vegetables, having well-balanced diet with some fruits. Portion size is the big one. So trying to work out what is a normal portion size can be quite open, and some people think what they usually eat is a normal portion size, but actually they're eating twice the amount of what they should be. So going online, having a look at the information, and again, your body's going to need different needs. So if you've got type 2 diabetes, but you're also like a manual labourer working 8 hours a day, you're going to need to be eating more food compared to someone that has type 2 diabetes, but is at home and is not as maybe sitting down at a desk all day working. So it's going to change person to person. Blood glucose monitoring is a big one, very, very big one. So if you've got type 2 diabetes, type 1 diabetes, even gestational diabetes, as in you've been diagnosed, then you should be monitoring it on a daily basis, if not more. So maybe even twice a day. if you don't have diabetes, this is something really important, is make sure you get a regular blood test by your GP. So what I mean by regular, once a year, once every 2 years, and it's just to make sure that we're keeping everything at bay. So you want to prevent getting all this stuff. You don't want to manage. So I'd rather prevent everything than have to manage this type of stuff in the future. So I recently got a blood test by my GP. I exercise about almost an hour a day, eat healthy. So, you know, there probably wasn't a reason for me to get the blood test, but I want to make sure that I'm preventing everything and we've got baseline measures as I continue to get older. Medication is a big one. So follow the advice from your general practitioner / specialist. So you may, there's different types of medication which can impact, obviously there's injections, it can impact the sensitivity of your glucose, but also the production of your glucose as well. So make sure you follow the advice of your general practitioner and specialist, and just try and educate yourself on that medication as best you can, and understand how it works and why it works. And then preventing complications. So it's a complex condition. All three are, and it affects many parts of the human body. So poor blood circulation, ability to heal cuts. A cut to an extremity can result in an amputation, which is what I mentioned before, at the most extreme cases. So trying to prevent these complications, and in putting in place your lifestyle factors, and getting a good management team around you, which should include a general practitioner, should include potentially a specialist, should include maybe an exercise physiologist if you've been diagnosed with one of these chronic conditions, so that they're well managed. If you want to prevent some of this stuff, or you know people that want to not get diabetes, well, then they should still be talking to their GP about how do I prevent. They should be still communicating with an exercise physiologist around, okay, what are things that I need to work on in my day-to-day life that's going to help prevent this as long as possible. It may be inevitable that you do get it because there's a genetic component to it, but instead of getting it at say 40, you're getting it at 55, 60. So there's a big difference in how you manage that. How can Kisa help? So accredited exercise physiologists are specialists in treating chronic health conditions with exercise. So they'll conduct an initial assessment, will outline your capabilities and develop a treatment plan that will focus on areas to better manage your diabetes. They'll be different for everyone. There's also what we've got here is something called the Activate group. So it's our diabetes exercise program run by our AEPs that is structured around the exercise guidelines and ongoing education on how to better manage your diabetes. These sessions are run over an hour, are a great way to socially interact with other people while exercising. You may be eligible to access assistance from Medicare via a GP referral. So you've got a couple of opportunities there, both through the EPC, which is one-on-one sessions, which are partly funded sessions to see an exercise physiologist, or there's also another program that's all about the diabetes groups. So have a bit more of a chat around with your GP around that, or contact one of the exercise physiologists in your Kisa centre that you go to, or that you may live close by to. Moving on, we also run the Life program within the Kisa centres. So this is a lifestyle modification program funded by the government to help reduce your risk of type 2 diabetes and cardiovascular disease. So you'll have to go to the Life program, so the link here, to check if you're eligible to access the program. There's facilitators all over, but these are the ones at the moment, so Geelong, Brighton, Mount Albert, Caulfield and Essendon. These are our Life program facilitators and do run these sessions. So get in contact with them if you're interested and if you're eligible, and they'll let you know when the next program is running. So I'll give you guys a couple of minutes. If you're in an area, say, you're in Mornington, or not in Mornington, you're in Mordialloc, and the closest one, not Mornington, so Frankston, for example, and the closest one is in Brighton, and Still give Ben, email Ben, even call the Brian Centre and maybe just get Ben to give you a call to see the best way to one, maybe be a part of the live program, because I'm pretty sure they're going all virtually at the moment, but also maybe what you should be doing moving forward. For any Queensland or New South Wales people in attendance, contact the appropriate AE people below who can help outline programs in your state that may be able to assist you further. So the live program in Victoria, there are other programs out there that you may be able to have access to. So Queensland, you've got Tash, and New South Wales, you've got Jessica, and they can help you navigate through all that. We have some questions now. I just want to reiterate, so if you want more information around diabetes, so Diabetes Australia is kind of the information hub where a lot of the information I go to around diabetes, and there's a lot of good information around what you should do, how you should go about it. Again, I'm going to reiterate this, it's fantastic that there's all this information out there, but if you don't apply any of it, or if you don't test and measure, so put some stuff in, see how it goes and see if it's actually worked, then you maybe not going to be able to best manage your condition. So for example, you may try doing a HbA1c in January, and then you decide, okay, I'm going to go on a new nutrition plan, and then do that for say 6 months, do another HbA1c and see if that adjustment has actually made a difference to your sugar levels. They're always making sure that we're testing, measuring, seeing if we're actually getting the results that we're after. I will leave it there. If anyone's got any questions, please put it into the Q&A.
Thanks so much for that, Hugh. While we just wait for a few questions to come through, I was just wondering if you could touch on a little bit more about how clients can access the services at Keyser at the minute during the current restrictions. Are they still able to come into the centre, and if they aren't comfortable in coming to the centre, are they able to conduct sessions via telehealth as well?
Yeah, very, very good question, Katie. So with face-to-face, you can still come in and see an exercise physiologist if you feel that is appropriate to you. So if you feel comfortable, you can still go to your GP to get a referral to do that, or if you just want to come do it by yourself, you're more than welcome to. If you're not feeling comfortable, you can do telehealth sessions. So still make contact with the exercise physiologist or Keyser, and they can help sort that out, because there's still a lot of things, even though Keyser is known for its exercise, exercise physiologists can focus on some of the other things, like putting in a bit more of a nutrition plan. So we're not necessarily dietitians that will sit down with you and take you through a specific plan, but basic stuff like eating healthier, portion sizes, looking at other things like your sleep, your stress levels, home exercises. So looking at a lifestyle management, not just an exercise management point of view. Our diabetes groups at the moment, I know some centres are still running groups, not in centre, but they are running them over telehealth. I know at the moment I run a Falls and Balance one, which works really, really well. And it's a great way to break up, your current, stage 3, stage 4 restrictions with something. You go online, you can see other people than the people that you live with. So they're working really, 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 really well. If you still don't feel comfortable, both don't want to do it over telehealth or don't want to come in, I'd still encourage you to make contact with the exercise physiologist, and they'll be able to help navigate. And once we all open up and we can start getting back to some form of normality, they can re-engage you and try and get you in and manage you as best they can.
Great. For any clients that may not have had a telehealth consult before, can you tell us a bit about what a client can expect from a telehealth session and how they would get started with conducting one?
Yeah, so telehealth will be over Zoom. What will happen is you'll get sent a Zoom link. You just have to click on that link, and you should be able to come into what we've got very similar now. From there, it'll be very much similar to a normal consultation, asking them how they're going, the initial assessment, getting a medical history, maybe the challenges, the goals. Testing may be a bit of an issue, but there's some basic testing that you can do. via Zoom. And then it'll just be, again, developing an exercise program or taking someone through their exercise program. Still, provide cues. We can still provide advice just like we would. It's just not face to face, which is a bit unfortunate at the moment. To access the telehealth, you just need to book in those appointments. So if you call the keys and number, you'll get transferred to the call centre and they'll be able to assist you. And you just have to ask, look, I want to be booked in with an exercise physiologist from this centre. I've got diabetes. I want to be able to better manage that moving forward. And they'll look at their diary and book you in for the earliest possible time.
Great, thanks, Hugh. By the looks of it, we don't have any questions at the minute. So is there anything you want to touch on, Hugh, before we finish up today?
Yeah, it's probably just want to reiterate that diabetes can be very simple, but at the same time very complex. Simple in the terms that we just want to better manage your sugar levels. Complex, there's a lot of things happening. So my best advice is always to seek help when you need it, but then also look at it as a long-term management strategy. Because if you start thinking short-term, just say, okay, I just want to get these sugar levels down, you may be able to get them down in the immediate future, but then what's going to happen in 5, 10, 15 years time? So always good to try and get those sugar levels down, but you make sure that you're looking after yourself long-term, and that will change year to year. We'll use COVID, for example. Someone with diabetes 6 months ago or a year ago is going to have to do drastic things with not being able to potentially go do the normal stuff they were going to do previously compared to what they are now. So they're still going to have to manage their condition, but it's going to change as you get older, as things come up.
Great, thanks so much, Hugh, for that. So thank you everyone for coming along and to our webinar today with Hugh. If you do have any questions after the session, you can always contact Hugh at the Geelong Centre just by contacting our support staff, or you can always send Hugh an email directly. So that is hugh.degaris@keyser.com.au. And thanks so much, Hugh, for taking us through the webinar today.
Thanks, guys. Hope you enjoyed it.